Local programming on KRWG Public Media made possible in part by viewers like you. Thank you.
Welcome to Fronteras, a changing America. I'm Jonny Coker. Like many other states, New Mexico is experiencing a healthcare worker shortage. While there was a push during 2025's legislative session to change state policies in an effort to remedy the problem, the debate over how to reform healthcare in the state continues. Joining me to talk about these issues is Fred Nathan, founder and executive director of Think New Mexico. Fred, thanks so much for being here.
Thanks for having me back, John.
Of course. And it's been about 6 months. So for folks that don't know who you are or what Think New Mexico is, can you just give us a brief overview of what you and the organization do?
Sure. So Think New Mexico is a results-oriented think tank serving New Mexicans. We're a little bit different than other public policy think tanks in at least two ways. One is that we have a bipartisan board of directors that includes Democrats, Republicans, Independents. We have, for example, former Republican Governor Gary Carruthers, a former Democratic Attorney General Paul Bardicki. The other way that we're different is we don't just issue white papers and cross our collective fingers and hope something good happens. We take our recommendations, convert them to legislation, identify sponsors, and then get after it and try to get it enacted into law.
And speaking of that, one of the latest policy reports that Think New Mexico put out last year, of course, had to do with the healthcare worker shortage in the state. Can you give me a little overview of that, and why is now the time for New Mexicans to be looking at this issue specifically?
So we have a dire healthcare worker shortage. So for example, New Mexico is the only state that's lost doctors in the last 5 years, actually 247 doctors. Meanwhile, nationally, the number of doctors has gone up 44,000. And there's really three reasons why doctors here either retire early or leave the state. One is our medical malpractice premiums are very high relative to other states. They're nearly double our neighboring states, for example. The second reason is that we have very low Medicaid reimbursement rates. And doctors tell us that they mostly lose money on nearly every procedure they do on Medicaid patients. About 42% of our patient population are Medicaid patients. It's the highest in the country. So that's another issue. And then thirdly, we're one of only two states that taxes medical services. And so that's a huge disincentive to attracting and keeping doctors here. So those were three issues we were trying to address this session.
And speaking of this legislative session, you know, the shortage was acknowledged by the governor in her State of the State address. And there was some stuff passed, some stuff didn't pass. What was your overall reaction to the legislative session now that we're past it a few months?
Well, we were very encouraged. One of the bills that we were able to pass creates a Medicaid trust fund, and that's going to help address the very low Medicaid reimbursement rates, which is one of the three reasons that doctors retire early or leave the state. We were seeking a $2 billion fund, and we were pleased that the bill that passed is going to be funded up to about $500 million in the first 3 years. And the way that works is when it gets to $2 billion, like a college endowment, 5% will be distributed. That's $100 million. And then that can be matched 3-to-1 by the feds. So it's going to create a annual fund that will distribute $400 million a year. And that will go a long way towards addressing that low Medicaid reimbursement rate and bring up those rates, which will help to keep doctors here and help us also to attract more doctors from out of state.
And Fred, that bill that you're referencing that did pass was Senate Bill 88, the Medicaid Trust Fund, of course. You know, with that investment now being made by the state, What are the implications of this new fund? What is it going to look like for folks on the ground, and in order to address this larger issue of doctors leaving the state, how is that going to address that?
Well, for one thing, so if the legislature has an annual fund that's generating $400 million, they can bring up these Medicaid reimbursement rates on every kind of Medicaid procedure. So in a lot of parts of the state, doctors haven't been able to see Medicaid patients because they can't keep their doors open. And so it will make healthcare more accessible to Medicaid patients at the same time as it will help us to keep the doctors we have, retain them, and also attract doctors from other places that might want to practice here.
And
makes us more competitive, yeah.
I see. And how do you anticipate that fund will affect provider participation rates in Medicaid reimbursements? Or in Medicaid not Medicaid reimbursements, but in Medicaid over the next few years?
I think it's going to make doctors much more willing to see Medicaid patients without having to sacrifice their practice or lose money.
I see. And I wanted to move on a little bit because that fund was a huge win. I guess let me ask this: do you feel like that the passage of that bill was a big win for Think New Mexico and for the healthcare landscape of New Mexico as a whole?
100%. We were delighted, and hats off to Democrats and Republicans working together. The governor for signing it. The lead sponsor was George Munoz, who really did a terrific job with it. And I should say the money's coming from the one-time oil and gas surplus, and in addition, it's also going to get some of the money. So when state agencies at the end of the fiscal year have surplus money, that has generally just reverted to the general fund, and now it will revert to this fund and hopefully get us up to $2 billion in the not too distant future.
And Fred, I wanted to move on to talk about GRT on medical services. Of course, Think New Mexico's policy report on the shortage. One of the pillars in that report is to make the state's tax policy friendlier to healthcare workers. And within House Bill 14, this large tax package would have eliminated GRT on Medicare on medical services. It passed the House, it passed the Senate, but was ultimately vetoed by the governor. So my question to you is, what was your initial reaction to that veto?
Well, naturally, we were disappointed by the veto. I understand why it happened, but just for a little background for your viewers, again, New Mexico, one of only 2 states that taxes medical services. Hawaii's the other. They tax it at 4.7%. In New Mexico, it's just the GRT tax. And so that's in excess of 8% in a lot of areas around the state. So it makes it very difficult for example, for independent practices to attract physicians to come here, because that's a tax they wouldn't have to pay in any other state except for Hawaii. So we were very encouraged. We worked with Senator Jeff Steinborn and again, a group of Democratic and Republican senators. Jeff was the lead sponsor, and Dave Hockman-Vigil was the lead sponsor in the House. We were trying to get rid of the tax entirely, to abolish it. It should never have come into practice in the first place. It's very counterproductive. It's kind of like the tax on groceries, which we worked to repeal about 20 years ago. It's just bad tax policy to tax necessities. And what a lot of people don't understand about this tax is it's not paid by patients. It's actually paid by healthcare providers. And that's because Medicaid and Medicare won't pay state taxes, they're a federal program. And then insurance companies won't pay it either because they're able to negotiate it out of their contracts. So it ends up being eaten by doctors, but also other healthcare providers like dentists, physical therapists. So it falls on on all the same people that we're trying to attract to the state, and is counterproductive in that way. So we were delighted when the legislature passed sort of a compromise. It wasn't everything that we wanted, but it was about $49.8 million, and it would have been significant. The problem was that they didn't have a way to pay for it. They passed it after they passed the budget. So the House and the Senate weren't in agreement. The House wanted to do it this fiscal year. The Senate said, let's do it next fiscal year. They ultimately ended up doing it next fiscal year. And the governor felt that that was irresponsible and they could just as easily pass it next year. We wrote her a letter encouraging her to sign it anyway because we thought it would send such a positive signal to the same healthcare providers we're trying to retain and attract that we were hoping she'd go ahead and sign it. But I understand what her reasoning was, and it could have been done differently, and so we understand.
And in the governor's veto, in her written statement, she did say that she was in favor of the elimination of that GRT on medical services. But moving forward for this type of legislation, what is the next step? What would you like to see happen, in the interim period or in the next legislative session in order to, get the GRT finally removed off of medical services?
Yeah, that's a great question. We're hopeful that in the 2026 session, which is a 30-day budget session, that we can bring this bill back and pass it. And it would be a good first step to removing the entire tax on medical services, and maybe push for a little bit more. But we'd be thrilled with taking $50 million off of that tax.
And in terms of reintroducing this bill into the next legislative session, do you think you would like it to keep it away from any sort of tax packages and keep it on its own? That way, if there is a piece of legislation, say the governor doesn't like again, it's not necessarily vetoed, that it actually goes through. What are your thoughts on that?
Well, that would be our preference, Johnny, but the practice in the legislature has been to pass an omnibus bill where they package up a series of tax increases and tax decreases. So we would obviously be deferential to the legislature as long as they keep in removing the tax on medical services.
And Fred, I wanted to move on to, and you mentioned at the top of the show, talking about interstate compact agreements, how that was a big pillar of Think New Mexico's policy report. But before we really get into the meat of that and what happened during the session, can you just give us an overview of what these compact agreements are and what makes them so important?
Yeah. So the healthcare interstate compacts, there's about 10 of them, and they sort of work like getting a driver's license. You get a driver's license in New Mexico, but it gives you the right and the privilege to drive in the other 49 states. And it's the same thing with these compacts. They were actually started about 20 years ago by the Department of Defense because many service members were moving around the country. They had a trailing spouse who was in the healthcare industry. They'd move to another state, and then their spouse would have to wait, 3 to 6 months to get credentialed and licensed. So this is an easy way, if states join these compacts, that they recognize each other's licensing systems, and it's a sort of a reciprocity system. So there's 10 of them, as I said earlier. New Mexico's only in one, that's the Nurse Compact, and it's worked extremely well, and there are rural hospitals all over the state that might not be open but for that nursing compact. And just to give you a sense, most states belong to most of these compacts. So for example, our neighboring states, Colorado's in all 10, Utah's in 9, Oklahoma's in 8, Arizona's in 6, even Texas is in 5, and we're in just 1. And your viewers may be wondering, well, what's the problem here? And the problem has been that the trial lawyers have blocked this legislation as they did this last session. Each of the compacts has a provision that says we're governed by a board of commissioners. So every time a state joins, they get a representative on the board of governors. And those governors are immune from lawsuit. And to the trial lawyers, that's sort of sacrilegious that anybody should be immune from lawsuit, even though you would never sue these people. And so that's been the hangup. This session, we got 7 of the 9 compacts that were introduced, passed through the House unanimously. They all then went to the Senate. They were assigned to the Senate Judiciary Committee. Only one compact, the Doctor Compact, was granted a hearing. It was amended 32 times. And even one amendment is enough to kill it because these are essentially contracts between states. The Doctor Compact has been joined by 42 other states, the District of Columbia, and Guam. So if New Mexico wanted to make an amendment, that would entail taking the compact back to those 42 states and going to each of their legislatures to say, well, hey, New Mexico wants this changed. So that's just impractical. And again, the only opponents of the medical compact were the trial lawyers. They were the ones that wanted it bottled up and killed, and they were successful. And just to give your viewers a sense of what this means for patients, I want to give the example of Michael Casaus and his family. He has 2 sons. The younger son, Sebastian, at 2 was diagnosed with a very rare and aggressive form of cancer, and they took their child to UNM Hospital. And the doctor said, we've never seen this type of cancer before, and we believe we're going to need to amputate your child's hand. But before we do that, we're encouraging you to get a second opinion. So the Casauses interviewed doctors around the country and found 2 really renowned experts, one in Pennsylvania, one in Michigan. And they contacted those doctors. And in both cases, the doctors said, bring your child here immediately. Let us examine him in person. And in both cases, they had to say, well, our child's undergoing chemo right now. It wouldn't be wise to take him through the airport, but could we do this on FaceTime? And in both cases, the doctors said no, because your state, New Mexico, is not in the compact. And therefore, we would be essentially, if we advised you just through telehealth, we would be practicing medicine without a license in New Mexico, which is a 4th-degree felony. So what they ultimately ended up doing, and they do this every month, is driving to Texas just to have a telehealth conference. And as Michael said to me, I can afford to do this, drive to another state, get a hotel room, but there must be thousands of New Mexicans who are in the same situation who can't afford to do that. And that's really the tragedy of the legislature being unable to get these compacts to the finish line and to the governor's desk. And she would have signed them.
And Fred, I counted myself 13 pieces of legislation addressing interstate compact agreements. You mentioned a number of those. I believe you said 7 of those made it through the House. But essentially what you're saying is it just the lobbying of these trial lawyers that is preventing it from advancing in the legislature? What's your take on that?
That's exactly right. So they got through the House unanimously, sent to Senate Judiciary. 2 senators, both trial lawyers, made 32 amendments to the Doctors Compact, which effectively killed it. So we really need to get with the trial lawyers and come up with some other solution. We need these compacts, and we're hopeful that we can persuade the trial lawyers to just let these compacts go so that tens of thousands of New Mexicans can get the health care that they need. The other compacts, just to give your viewers a sense, there's a compact for dentists, there's a compact for physician assistants, there's a compact for EMTs. These are all healthcare provider categories where we have shortages. So anything that can make it easier for these doctors and providers to come here to get credentialed immediately and start practicing is all to the good.
And Fred, have you spoken, and you mentioned the Senate Judiciary Committee, correct? Have you spoken to any of the leadership within that committee, whether it's Chairman Joseph Cervantes or anyone else within that committee, about this legislation being stalled?
We tried, and we talked to staffers on that committee, and they just said that there's just not the appetite to pass it this year. And so, we need to do a better job ourselves of lobbying and activating grassroots groups to help us. And we're very encouraged. We generated about 15,000 emails during this last session on those 13 bills that you mentioned, Jonny. But we need to do better. Maybe we need to generate closer to 50,000. And I would encourage your viewers, and they can do this today, to go to our website, www.thinknewmexico, written out as one word, .org, and just click on Take Action. And we have prescripted emails. We always encourage people, we have no private authorship, to delete the prescripted language and just write about their own lived experience. We find that there are many New Mexicans that can't find a doctor, or if they have a doctor, they can't get in to see them when they need to. And so we've encouraged people, again, to go to our website, contact their legislators, and encourage them not only to pass these compacts, but also ending the tax on medical services and medical malpractice reform.
Mm-hmm. And you mentioned medical malpractice reform, and we don't have a ton of time left, and I do want to get to that, but I did have one question. There was a bill, House Bill 143, lobbyist transparency bill, that would require lobbying activity reports on legislation, including positions taken by lobbyists or their employers. That ended up passing through the House and Senate and was ultimately vetoed by the governor. But I was wondering, would a transparency bill like that, do you think that could also help with bills like the ones we're talking about right now that do have a lot of meddling in them by trial lawyers and people with interests in the state?
Yeah, I thought that was a very positive piece of legislation. I commend the sponsor, Sarah Silva, Senator Jeff Steinborn, and it's unfortunate it was vetoed. But yeah, I think that's a step in the right direction for good government. I think the public has a right to know who's behind killing bills like this or passing bad legislation. The public should know who's being paid to lobby and what positions they're taking. And I'm a lobbyist. I like to think of myself more as a public interest advocate, but I'm a registered lobbyist. I would have had to comply with that law, and I would have been happy to do so.
I see. And that brings us to, of course, talking about medical malpractice. A bill supported by, I think, New Mexico specifically, Senate Bill 176, of course, would cap attorneys' fees in medical malpractice lawsuits, as well as many other provisions. So why is that such an important piece, an important pillar of making, alleviating the doctor shortage around our state?
Yeah, that's probably the single biggest reason that doctors retire early or leave the state. We've created this legal paradise for lawyers to bring lawsuits, and we have the lowest standard for punitive damages in the country. We have no caps on punitive damages. We have no caps on attorney's fees. And our point with Senate Bill 176, which Think New Mexico drafted, was to try to change our medical malpractice system to make it more about the patients and patient-centered rather than lawyer-centered. And so, for example, you mentioned, Jonny, capping attorney's fees. What a lot of people don't understand is it's a zero-sum game. The more money that goes to the attorney means less money for the patient, to make the patient whole from whatever harm that was caused by medical malpractice. So that was an example of something. Another part of that bill would have said with punitive damages. So there's two types of damages that medical malpractice victims receive or can receive. One is compensatory damage, which is designed to make them whole for their injuries. And then when there's been gross misconduct, which is very rare, then there's the possibility of punitive damages. And as I said earlier, in New Mexico, we have the lowest standard. So they're often, in almost every case, they're pleaded. And many times doctors, even if the case is frivolous, are inclined to just settle the case because they don't want to risk that they'll lose their whole livelihood and everything they've earned over their lifetime because they don't know what a jury's going to do. So many of these cases, even the frivolous ones, can get settled for millions of dollars. So we propose taking 75% of any medical malpractice punitive damages and put that in a patient safety fund that could be used to enhance training or reduce the doctor-patient ratio or other health nurse-patient ratio. Those are things that will make medical malpractice much more rare. So we thought that was a good idea. On the attorney's fees, which I mentioned earlier, many progressive states, and of course New Mexico is a very progressive state, but California, Massachusetts, New York, all progressive states have capped attorney's fees. In Senate Bill 176, we just adopted the California model, which is 25% of any settlement would go to the attorney. If the case went to trial, which is more work, then it would be 33%. And we thought that would be very fair. And again, help patients to be made whole. Less money going to the lawyers means more money going to the patients, which is, we think the foundation of any medical malpractice system should, at a basic level, ensure that all the patients who are harmed by medical malpractice are made whole.
Well, Fred, I appreciate you coming on the show. Unfortunately, we are out of time, but it's always good to talk to you to hear about what Think New Mexico is up to, and I'm sure we'll have you on the program again.
Many thanks, and very much appreciate it, Johnny.
Of course. And that's all for today's episode. Remember, you can stay up to date on the latest local news at krwg.org. For all of us here at KRWG Public Media, I'm Jonny Coker, and we'll see you next time on Fronteras, A Changing America.